Welcome to the Homefront Podcast, hosted by me, Becca Bookman. The Homefront Podcast aims to introduce you to the people, initiatives, and ideas shaping Israeli society from within. Since October 7th, there has been a serious conversation about mental health. I have never heard the word trauma used as much as I have since the start of the war. On today's episode, we're joined by Moshe Daniel, a dog-assisted therapist. We'll be talking about his work and his personal experiences working during wartime. Welcome to the show, Moshe.
Hi, good to be here.
Moshe, we like to start off our conversations by doing a little bit of a check-in. So how is your Zionism doing today?
Pretty good. It's pretty good seeing how all of the individuals in Israel have been coming forward for Israel and outside of Israel. I have 3 brothers in the States, and all of them came here to give their time, volunteer work, do their part, and we see this throughout the world. I think Zionism is it's up and coming.
I love that. So on today's episode, we're going to be talking about mental health and your work in the field. So why don't you tell us a little bit about what you do?
So dog-assisted therapy or canine-assisted therapy is similar sort of to animal-assisted therapy, but very, very different. I'll explain a little how it works, let's say in the States. We have there a therapist and a dog, and the therapist lets the dog do all the work. As in, he has a therapy with the kid, and the kid has to come in and he'll talk to the dog, and the whole experience will be the dog. Here in Israel, we do things differently. We have more of a hands-on approach, where we, the therapists, have to deal with what the issue is with the kid, with the teenager. We'll talk a little more about that later. But what we do is we have therapy programs. Each program, each individual is a world of his own, and we approach each individual on his own level.
That's amazing. Mm-hmm. That sounds like very rewarding work.
Yes.
I know very little about dog therapy and all of that. So what does a typical session look like?
Depending on who is getting the therapy, we have work done through training the dog, grooming the dog, taking basic care of the dog, feeding the dog, learning about the dog. We have open conversations. The world of dogs, very similar humans. At the end, we're all animals. But what we have over there is that we work with these dogs, trying to figure out what issue the patient came in for therapy. And a lot of these issues could be approached by any of those things that I mentioned. So we have, for example, a lot of the work I do now is in the mental health systems. And what we have there, let's say I have girls who receive therapy who have anorexia, and we deal with that through the dog, by weighing the dog, by feeding the dog, them taking care of the dog. So this could be one example. Another example is a kid who has anxiety, and this, you talked about the October 7th massacres, and what we have here is we have a whole country now throughout Israel, and everybody's in anxiety. And through these dogs, we see how they calm them down. Even having 15 minutes of petting them has them calm down. So when I bring a dog in, I'll say that since October 7th, dog-assisted therapies and therapists throughout Israel have been called on to come and join the workforce. And this is for not only kids, but also for the Army Reserves and people in the IDF. And what we did as animal therapists, we went over to Army bases, and we went over to children in hotels, and we brought dogs over, and we see that all their thoughts are on, what's going on down south, what's going on at home. Siblings that are in the war, parents in the war, and then they have 10 minutes with the dog, and you see how they calm down. I took one of the kids that I met in one of the hotels. He just fell asleep on the dog. He just calmed down. And I talked to his parents. They said he hasn't slept in months, but you see him just calm down. People are in a wreck. They just have this moment with the dog. It's amazing to see it.
Tell us a little bit more about how mental health needs have changed or shifted since the start of the war.
So we saw after COVID how all the levels of the mental health system started crashing over here, because you have kids. It wasn't that these kids didn't need help beforehand. It's that they only found out, the parents found out, that they suffer from anxiety to begin with. And all these things started approaching them when they were at home. Now, the war was similar to that, but it's a little different. First of all, we're talking about kind of like more on a private scale than it was worldwide. Here, this is happening to us in Israel. And these kids going through what they've already been through beforehand, COVID, we saw how everything sparked up in those years. That I think is something like 200% of the mental health system went up and shifted to that. And what we have in the wartime is even more stressful because it's not only then. I think it was more uncertainty, and today what we're talking about is actual missiles being fallen down from the sky. We have, as I said, parents and siblings out in the war. It's very stressful times. So whether you have mental issues or not, you now have to deal with it.
Basically, everybody's been affected. If you had a mental health issue before, or you didn't have one before, everybody has something they're carrying at now. Yeah?
Right.
Has demand for dog-assisted therapy gone up? What's changed in that work?
Way up. Again, when I started back in the COVID, and that was really, I saw how people started calling me, and now I don't stop receiving calls, nonstop. Because we have people, as I said, children from down south here in the hotels. We have the Army Reserves also here in before and after battle, and just people in stress. Missiles shot down to Jerusalem, so I get a lot of calls.
That's intense.
Yeah.
Let's dig into these examples that you've brought up. You've mentioned the South, you've mentioned the Army, you've mentioned people in general. Tell us a little bit more about the different populations that you're working with.
So specifically, I work in a center called Ofer Dog Therapy Center, located here in Jerusalem. They work with programs in and around Jerusalem mostly. Part of the work that we do, besides the volunteer work, as I said, therapists from all across the country came in to do volunteer work. So we joined in on that, and I personally joined in on that. And the programs that he runs through schools and hospitals, and we have also psychiatric wards, and a place I specifically work in called Beit Daniela, which works with youth that are in and out of psychiatric wards, and a place I call that's called Masila, that's a juvenile detention and rehabilitation center for young women, and we see how what happened. In general, of course, it affects them, but also these people, as I said, they have siblings in the army, they have parents in the army, they themselves are from the South, and we see how what we're doing, especially in these times, is really important.
What are you doing?
What are we doing? So, as I said, different therapies work differently. Specifically, these two places that I work in, Beit Daniela and Masila, we have kennels built in to the programs in the institute. And what I do is that I have these kids run the kennel. These kids are in charge of everything that's to do with it from A to Z. They train the dogs, they bathe the dogs, they take care of them, they feed them. They do all the work. And we see not only projections, which is what you usually, most of what I said in the States, that usually what they like doing is projections, but this is actual work. We have kids in mental health states that are really, really tough, but we see how they give from themselves, from their heart. They really give into the work for the dogs. They've kind of find meaning through this.
You've mentioned quite a few times that you work with younger populations, kids and teenagers. Are there unique things that those populations are facing because of the wartime?
I'd say, of course. I think in general, it's always easier for an adult to go through these things. Even us, we could be stressed and, we have anxiety, but it's different. Kids don't really know where to take that, what to do with these emotions, emotional vocabulary, these kind of things. Very difficult for kids and teenagers. And specifically these teens that I work with that are, as I said, in rehabilitation centers, it's very different work. These kids, they low self-esteem, they have very difficult times, difficult backgrounds. And in general, youth and kids, I think it's usually easier for us to get through to them And I think, of course, they just need that support more than we do. But that's not to say that I don't work with adults. I have a lot of adults also coming with also a lot of stress, a lot of anxiety.
So, are there any trends in the adults you're seeing and what they're coming with during wartime?
It's interesting. Usually, each individual to his own. Because we have a lot of people. I have people calling me that are out of the army, so they're suffering from PTSD. We're opening up a new program now for people suffering with PTSD, which is a big thing. We have parents who have difficult time with kids at home that they don't know what to do with these kids in these stressful moments. So I do that also, parent counseling. There's a lot of work to do with adults too.
Just knowing how hard it was to schedule with you, you seem like you're jam-packed helping as many people as possible.
I came in work attire. Had no other choice.
Can you tell us a little bit about specific cases that you've seen during the wartime and what maybe has been, what's popped out to you?
I work in Tzur Hadassah in Beit Daniela, a school for youth with mental issues. And these kids, I'll say that the mental health system, it's there's a very wide spectrum, different kids, different backgrounds, different illnesses, sicknesses. And I'll maybe explain later why I phrasing it this way, sicknesses, although a lot of people don't like that phrase. But we have what we do there. We have kids from different backgrounds. As I said, some kids, I'll say, suffer from eating disorders. Some kids from anxiety attacks. Some kids from sexual abuse that they have PTSD. And what we do there, I'll say that each kid I work with individually. We also have group sessions, and I have individual sessions with them. But as I said, they run the kennel, and through them running the kennel, I could also get to what kind of goal they're trying to reach. Each kid, the program is only 6 months, so this is a short-term program. Used to be that these kind of programs, you'd want them long-term. The psychiatric wards could have kids, youth in there for a year and a half. We're talking about half a year, where at the beginning we set goals. The kids set goals with us. And we try to reach these goals throughout what we do there. We have equine therapy, we have dog-assisted therapy, we have DBT. And what we do with all of these, we try to reach their goals. And we're very, very open with them about what we're trying to reach. A girl who has an eating disorder, we talk to her openly about the eating disorder. We don't try to, hide it under the rug. We get to it. Now, we have individual cases. I'll say, first off, is that we have kids from down south. So let's talk about anxiety. Kids are already coming from anxiety, have them already stressed, and they come to me and we try to work on that. But moreover, we have, I'll get into specific stories later, kids that suffer from OCD, and not regular OCD that we're talking about. I have to move this pen because it's not in place. OCD, they will not walk into the kennel. So I have one of the teenagers now in the program. He's been 2 months now, and he only about a month ago started walking into the kennel. He had a problem with taking out dogs. Now we're working on that. I give him a day that he could take and a day that he can't take, and we're really reaching these goals. Girls who have a problem talking about the food that they're eating. We talk about the menus. We talk about what dogs eat and why it's important to eat. What I said about OCD, we have, I run also a dog grooming program. And what they do also there is they have to really overcome the OCD. So all these things. I'll maybe get to specific stories later.
Let's get to specific stories now.
Okay. Where to begin? There's so many. It's just really...
Can you maybe give us a little bit of insight into your work with evacuees who are now at hotels throughout the country?
So as I mentioned earlier, just having a kid that I know that he's under a lot of stress, that he can't sleep at night, and having him 15 minutes with the dog, then he'll be okay. There are a lot of stories. These kids, I'll say that we had one of the times that I was working, I was doing volunteer work, and there was a Tzeva Adom, Hazaka,
A siren.
A siren, and we had to run in with the dogs. And one of the kids asked me, he said, how are they so calm? The dogs aren't stressful. He said, I know that dogs usually go crazy from sirens. How is he so calm? Could you teach me to do that? Yes, let's do that. Let's work on that. Let's talk. Let's sit down, and really get into why a dog is not stressed from this, and not talk about why a dog is stressed, not why is he not stressed from this, what helps him calm down. And this kid specifically also projecting all of these emotions. It's amazing to see. It's amazing to see him also leave this therapy and calm down, kind of get back to his own self. I'll say that's most of the stories that I have are mostly like that.
I want to explore something you just mentioned a little bit more. I know for myself, like whenever I hear fireworks, I hear the booms and it's very stressful. So when you hear a siren, why are dogs calm?
Dogs have conditioning. That's most of what we teach them. Either the condition to, yes, be afraid of the sirens or not. It's something that also I bring up a lot in therapy. We have Yom Ha'atzmaut coming up, and every year they talk again about if they should or not allow fireworks because of people who suffer from PTSD. And one of the things, it's a funny thing because one of the things I try to deal with is to overcome that. So when we're talking about not having it, I'd say, again, I'll be very sensitive to the issue because there really is an issue here of loud noises and people suffering from them. On the other hand, we do want to approach it. And dogs not being afraid of it, I think, is a great example. But again, that's more of a conditioning. And sometimes we're stuck there too. Sometimes we're also in a place of, okay, these are fireworks. It's a scary thing, but also some things that we could work on ourselves.
It sounds like through the work that you're doing as a therapist, you're actually able to anticipate some of the challenges people might have moving forward during the wartime, yeah?
Definitely. I'll say that also after COVID, and especially now, is people leaving their houses. People have a hard time leaving their houses. And
the first week, I couldn't leave the house. I remember the second day of the war, I had a friend come over. He was out walking. I was not comfortable with that, but I went to the bottom of the building, and at the beginning, I could only go from one side of the building to the other side of the building. By the end of the walk, he got me like going both sides of the street, basically. But yeah, no, the first week of the war, the streets were quiet.
Yeah. Oh, yeah. And moreover, because of all the sirens, you had to have a place to run to.
It was definitely on your mind of, am I taking a route that's going to have a shelter nearby? Is it not? Like,
given that, we have these people that, and I know beforehand that this is going to be an issue. After the 7th, we said, okay, people are stuck at home. That's exactly the issue, and we know that these are things that are coming. I'll give another example. Social examples. Is that I know that these kids will have social anxiety afterwards. After COVID, we saw an uprising of that. We saw a shift in that because we knew that kids were stuck at home for a year's time. They didn't meet any friends. They weren't allowed to. It's close to that. It's not exactly the same, but it's something similar. We know that there are a lot of social challenges. Also, each person has, as I said, siblings and parents in the war, and it's very hard to communicate when you know that you're under such stress and anxiety. So it kind of bothers communication generally and socially. So these kids, they really have a difficult time with that.
You mentioned the volunteering that you did. You had your job and you were also using your profession to volunteer. So how did the volunteering expand what you were doing? Were you working with other populations, different people? How did things change for the volunteering?
The country really is dependent on a lot of workers like us, especially for the educational system. And what they usually do here, what we saw, which was really amazing, that they really came forth with the army. That was amazing to see, because usually the army is important, and they've been treating PTSD differently the past few years in Israel. But now specifically that they understand that this is really what's important. So I'll say specifically there that they asked us to come to army bases and meet the soldiers in the hospital and do all this work. And that's very different. This is something that didn't exist a few years ago.
So what is your work with soldiers been like?
It's not easy. You have people coming in out of battles. You have people not even out of battles, people that you know that, I'll say also in battles, also injured. people who, again, have loved ones in Gaza. And it's difficult. Some don't have the heart to talk, and the dog is there, so they just use the dog just to be there. And some just give it their all. They have a dog there, they have a therapist there. Let's talk. I wouldn't want to get into detail, but they really need it.
I'm curious for the people that you're treating from the Army, what's been their response to discovering even that there is such a thing as dog-assisted therapy?
I'll say that in Israel, it's a pretty popular thing. So most people already know that this exists like other animal therapies. But specifically here, they're just excited to see a dog. Like they don't care. They see a dog and that's it. That's their whole.
Have there been barriers to people from the Army wanting to seek therapy, wanting that help?
So what I feel is that more the Israel in a whole has been pushing more to that. Not only the government, but NGOs and individuals are really pushing that these programs will be certified and will get kicked off the ground. I know that specifically the farm that I work in now, they got a program now from the Defense Ministry that a few $1 million shekels to start a therapy program for PTSD soldiers.
That's amazing.
Yeah. And you're going to have these programs, you're going to start seeing them pop out everywhere now. And they're trying to locate as many people, as many therapists as they can. It's very cool.
What you mentioned, I actually wanted to ask you, is there enough therapists?
In Israel, it's a funny thing, but in Israel, yeah. In Israel, a lot of therapists. Not only animal-assisted therapists, but we're talking about everything, the whole range. I think in Israel, it's one of the best countries for therapy.
Why do you think that is?
I think most of the therapists here, it's not only that there are so many. It's that I think there's something, you asked about Zionism, Israelis, something from the heart. Even Zionism, there's something there. It's not just, a place, a people. It's something in the heart. It's something that we all own up to as Jews.
You're saying that it's obvious that Zionism has this component of loving people and wanting to do good, but it's not obvious that Zionism relates to therapy necessarily. If you go back to the beginning of the state, the idea of the new Israeli or new Jew, something like that, they saw themselves as being very tough people. And tough people you don't associate with going to therapy. So something has shifted, no?
I'm so happy you asked this. This is a conversation I have with a few of my friends, a lot of friends now also fighting in Gaza. And one of the things that we talk about most, because of all these new therapy programs and me in my therapist position, I try to understand from them. This is a little bit of a tough subject. I'm sorry. I'm gonna I have a friend who was in Tzuk Eitan in 2015, and he had PTSD, and he really wanted to join in the reserves, and they didn't let him. And it was a big question: could we let people who suffer from PTSD, if it's even correct to have them go and fight wars, because this is something we're afraid of in the first place? Now, in these conditions, I'd like to say no. If we know that this is somebody who has to go out into the battlefield, no. If we know that he's suffering from this, it's too much of a risk for us. It's not what they're in for. Now, that's the approach that's I'll say prehand. If we're looking at after the fact, there is something. I had a conversation last week with a friend exactly about this, which is how correct is it, especially at this point when we're in and out of the war, to have them really get deep into where they are emotionally, because opening up these emotional states is maybe I don't know. It maybe confuses when you're out in the battlefield. And is this the correct thing to do?
There's a lot of complexity in this whole conversation. One of the things that I've heard people talking about a lot is, where are we in the trauma now? Is it behind us? Are we still experiencing the trauma? Where are we in time?
So one of the things I really deal with at work is trauma, PTSD. This is what I said, working in the mental health systems. And it's something that we have to deal with a lot, because that line between having a traumatic past, and dealing with it at that same time, or having, let's say, anxiety attacks, or having trauma in it as itself, is very difficult to understand where that line crosses. It's very gray, and we have to try to understand that all the time. But there is something to it that I think we are currently in trauma. It's kind of hard to say, because I think that we've gotten so used to the day-to-day routine. Everybody knows, okay, we're in a war, we have to do this, hopefully, and unfortunately preparing for the next war. But we're traumatized.
So it's very clear that we're still experiencing trauma, that there's still an earthquake going on. Do we have any idea when that will end? Will it just be when the wars are over, or sometime before that? What's your take?
Look, when we had talked about COVID, and the big question there was, first of all, back then we said, is this ever going to end? People, I remember they talked about the World Health Organization, the president of the World Health Organization, about 2-3 months after COVID began, he said there's not going to be an antidote for this, and that's it. We know things are different. We're talking here with no masks and not separated by 2 meters, and we overcame it. Even here, I'd say that, we're in it. We won't get over it, but we'll overcome it.
We will overcome. And what do you think it will take to get us to that place where we have overcome?
I think we're a really special people. We had a lot of criticism before the war towards, Haredim, ultra-Orthodox Jews. And we had a lot of these arguments. We had, again, a very short memory that we have as people. People kind of forgot that we were arguing not even a day before the war. And it's a little sad to see that coming back to itself now. But I think even with that, like I started mentioning the criticism towards the ultra-Orthodox, once the war broke out, we saw how they really came through, work in Zaka and volunteer work, and really being there for society. It didn't matter if you were non-religious, if you were, this didn't mean anything to them. I think that's really the where we're measured, because we really come through for each other.
I want to take us back a little bit to the dogs. Those of us who have furry friends at home, I do not, but those who do, are there things that they can be doing, techniques they can be applying to help use their pet to help them through difficult times?
So I'll say dog therapy throughout the world, also in Israel. In Israel, it's a little different, but we usually have certain breeds that we work with that we know that these are good for therapy. Golden retrievers, that's the classic therapy dog. Labrador retrievers, that line of dogs. But what any dog that I'd say, especially if you bring a puppy, you could start off with really just having him conditioned to any kind of situation. We talked earlier about dogs that really don't mind sirens. I had raised puppies at home, and from the beginning, I'd say 2-3 weeks in, that after they were born, I started putting noises, sirens, and construction noises, and that kind of thing, just to have them regulated to that. And so first of all, just conditioning for that, just to have them very, very calm. Once they do this, especially at early ages, so they don't mind anything. And that what we call exposure, we do that with all different kinds of things, also hugging them. Usually a regular dog, if you find him adulthood, he won't like being hugged. But if you train a puppy to begin with, to enjoy being hugged, to enjoy being pet, socialization, that's something that we really work on, and I really recommend working on. So not only the people at home benefit, but really, as you asked, if we could help others. So I'll say that the dog-assisted therapy programs throughout Israel that came through for the war, to do volunteer work, a lot of people just have random dogs. That's why I said Israel is different, because in, let's say, the States, you have to have a golden retriever. It doesn't work if you just find a regular mutt. But here in Israel, I have a friend who only works with non-purebred dogs. He works with only mutts that he found in kennels, and he trains them as therapy dogs.
Were people volunteering their own dogs to help with dog-assisted therapy?
Definitely. definitely. That's I see most of the not all, because most people who are dog assisted therapists usually bring in a dog throughout the when they study, so they could train them as therapy dogs. We had some families from the south who were in hotels that they would have their dogs from home. Instead of me bringing a dog, they had their own dog there, and I wouldn't use these dogs in regular therapy, but if it's these kids' dogs, so no problem.
So it sounds like most dogs, at least if you go according to the Israeli model, you can use many different dogs for therapeutic reasons. If I were a dog owner and I had a dog at home, are there things I could be doing with the dog to help myself or to help friends?
So the person I learned therapy from, the first kennel that I worked in, he told me exactly that. Every dog could be a therapeutic dog. The question is what kind of therapy. So I'd say even if you have, I know some kids who grew up with Rottweilers at home, and not the nice kind. There are really good Rotties out there, but some are not that nice. And even so, these kids, they have their own look. If we're talking about projection, I'd say if you're a parent and you have a dog at home and you have your kids talking to the dog or projecting to the dog things that you might not even think. Usually in projections, we see that the kid won't talk about himself. He'll talk about the dog. He said the dog is scared. This is something that we want parents to notice. The dog isn't sleeping. He's not eating. He's not, and sometimes these things aren't even true, but we see that the child is projecting. So that's one way, I'd say. The second thing you could do is have these dogs trained to be more like service dogs, having them, as I said, regulated to being hugged, to giving love, licking. It's a lot of kids just need that, being licked on the face, and they go crazy for it. It really helps them, relieve stress. So stuff like that. Having a dog, I'd say, even in a position where he's, a static position, he doesn't have to move at all. That's something that we like to see with therapy dogs, like that kid who fell asleep on the dog. The same thing. If you have a dog who's that calming at home, that's great. And also, I'd say even on the third level is some kids just need to relieve some stress by being active. So activities with dogs is great, as they also anybody would recommend sport and that kind of thing. So do it with the dog. There's a lot of things you could do with dogs, training them, fetch, teaching them frisbee. It's a whole world.
And obviously there's a disclaimer that if somebody really needs help, they should seek out professional help, yeah?
Definitely. And I'll say in general, with all, as is right with all therapy, it's very individualistic. If dog-assisted therapy isn't for you, maybe equine therapy. And I'm for any of the therapies as long as it works. I do dogs. I love dogs. People I see that love dogs, I recommend definitely.
I think what you mentioned about individual is a great segue to our next questions. From your individual perspective, what have been the most challenging or rewarding moments for you in the work that you've been doing?
Look, it's difficult. It's not easy. Somebody told me a few weeks ago. He said, "I don't know how you do it. You start the day and you end the day with talking about mental issues and talking about suicide and eating disorders. It is difficult. It is difficult. I think it's easier with a dog. Maybe one of the reasons that I'm still sane. It's fine. But I'll say that we have some stories, I'd like to say, on the more difficult side, some stories we have a few patients who are hospitalized after long terms of treatment. It's one of the bigger issues that therapists have to face is the worst outcomes. I'll say that the place I work for, Beit Daniela, was opened as a nonprofit organization to begin with, from Daniela Pardes, a 16-year-old girl who took her own life. And that's the extreme. That's why I said earlier that's a sickness, and we try to overcome these sicknesses. That's the tougher level. On the lighter side and the easier side of it, the success stories. Wow, the success stories are amazing. Kids, it's not only, I'll say that what I talked about, therapy, you have it in settings where, This might help them this moment. They have to take care of the dog, they have to train him. What's onwards? But that's why I'm setting goals with a lot of these kids to know what they're doing 6 months time from now. And we do this through the dog. So I have one girl in the program now who really wants to go to veterinary school, and I have connected her to our vet, who we work with every day, just so to have her running into this, getting into that.
That's beautiful.
Yeah. On the other hand, success stories like we have with Beit Daniela, what we do every year to fundraising, we do the Jerusalem Marathon, and we have kids who finish most of the alumni. We also have an alumni program, which they have also is built into the kennel. They, instead of having, they work through, they learn throughout the day. They have math, they do bagriyot, and all that, but they have the kennel. So the alumni program focuses on them being in the kennel. And we have a lot of people in that who come to the Jerusalem Marathon, who have gone on to the army, who are now in special forces. And it's amazing to see these kids who were once suicidal or once with mental issues or disorders, that they really up and coming. It's an amazing thing to see.
With everything that you have been doing as a therapist, volunteering and working, how do you see the changes that are happening in civil society in Israel, their impact, both in the short term and in the long term?
Me individually, could I say that I find that something's changing? I really hope so. I really hope that people are more aware of what our needs are as a whole, as a country, as a people. But I think it'll take time. It'll take time. We're always kind of taken aback from every new war. But I could tell you, we'll talk in 3 years, and there's going to be another war. That this is
please God no.
Please God no. That's what we love saying, but that's our people. That's one of the things that we're facing. The question is, could we hold together? I think we can. I think that we really have proven ourselves over and over again. We will overcome. That's as I said.
Do you see a change in how Israel is approaching mental health services in the short term and how that may impact in the long term?
Definitely. I'd say that, especially after COVID, I'm sorry I keep on bringing it up, it really did change a lot of how the systems work here. And the expectations of the people of the system has also changed. So I think, yes, definitely. After COVID, they knew how to deal with things like kids learning at home on Zoom. And when the war broke out, they said, okay, now we know how to do this. The same goes for the mental health institutes, which they were packed to begin with. Then they were overpacked 200% because of the COVID. And after that, now that the war started, I think they know how to approach it correctly. They do ask therapists in Israel to join the force, to give what they can. But I think it's not only them asking, I think it's more that the people ask, and then they give from there.
You and I could probably continue this conversation for hours. But before we end our episode, I like to ask every guest at the end, what is giving you hope today?
I talked about the people. Unity is a big thing. I think a lot of it really does have to do with hardship, love. I think we're a people that we love individuals. We seem always so separated into tribes already, and even through there, we break that barrier. We really find ourselves in togetherness. There's a love, there's a connection that we do have as a people. We see it with the people coming in from all across the world for our aid, Jews coming across from all the world for our aid. It really keeps us together. I think there's a lot of heart.
A lot of love and a lot of care, and a beautiful way to wrap up this episode. Moshe, thank you so much for joining us.
Thank you, Becca.
Thank you to Know Me Studios, and thank you to all of you joining us today. You can follow the Homefront Podcast on social media for updates, and we'll see you in the next episode.